Hi, folks. My name is Greg Turner, the radiology coach. My job is to demystify the enigmatic world of x-rays. Generally speaking, most people are unaware of the training required to take x-rays. Unfortunately, the work appears to be easy, but anyone who has ever attempted x-rays will say otherwise. Sure, it's not too difficult to x-ray a hand, but the further one expands into the human body, the more knowledge is required. When x-ray operators are administering examinations, they are expected to present fully diagnostic images for the physician or radiologist to interpret. When looking at an injured hand, a basic x-ray with the hand spread eagle over a plate doesn't provide enough information to rule out injury or anomalies. The hand is a three-dimensional object that can be observed from many different perspectives. In the practice of x-ray, there are several approaches that the professional can take in order to provide a doctor a study that is adequate. The hand can be imaged from front to back, back to front, medial-laterally, lateral-medially, oblique, or axially. Mind you, this is just one body part. To appreciate all of the approaches that a professional can take, one must understand that there are hundreds of individual x-ray positions that can be radiographed. The x-rays depend on the angle of the camera, the position of the patient, and the orientation of the anatomy. So, if an x-ray specialist wishes to take x-rays of the TMJ joint, they must take into consideration the anatomical parts, the orientation of the anatomical parts, the body structure of the patient, the angle of the camera, and the orientation of the anatomy as it relates to the camera. In addition to all of that, the specialist must be familiar with x-ray technique factors of which to expose the patient with. This may explain why a seemingly simple x-ray may occasionally require more than one attempt. It kind of resembles children watching their parents drive a car and feeling as though they could do it just as well. We can all agree that the child may not understand the full implications of getting into a driver's seat. Well, in the same way, radiology presents a number of invisible challenges that can be overcome, but can occasionally serve as a stumbling block as well. Radiographers who thoroughly know anatomy and understand how that anatomy displays itself geometrically become the best practitioners. Radiologists appreciate x-ray staff members who not only can determine where bones and organs reside when they are administering the x-rays, but they also favor those who can look at the final x-ray images and evaluate whether or not these structures are in the right place. A good x-ray operator can look at an abdomen and tell if there is motion that will interfere with the physician's interpretation. They can see if the ankle mortise view isn't rotated enough to visualize the lateral joint space, or whether a chest x-ray is too rotated to interpret. X-ray specialists have the ability to evaluate x-ray images to determine their level of interpretation. The reason for this is so that they can immediately evaluate and repeat x-ray images if necessary. It is beyond the scope of a technologist's practice to diagnose x-rays. Truth be told, clinicians have a high understanding of diagnostic processes because there exists a level of imaging where technologists can optimize their images to fully display abnormalities or anomalies that are apparent. If the tech does not use these techniques, then it is harder for the physician to read the images. Hence, there exists a pseudo-boundary where x-ray staff are critical in acquiring important information for the care of the patient. And it all resides in their understanding of anatomy and physiology, and to some degree, pathology. That concludes this episode of Why Do Radiographers Need to Know Anatomy? If you like this presentation, please select the subscribe button below this video. You can also tap the bell next to it so that we'll notify you when other great videos have posted. My name is Greg Turner, and I'm the radiology coach. And remember, mark my word and mark your films.